If you haven't heard about Anchor by Spotify, it's the easiest way to make a podcast with everything that you need in one place. Let me explain. First off, Anchor has tools that allow you to record and edit your podcast right from your phone or your computer. And also, when you're hosting on Anchor, you can distribute your podcast on listening platforms like Spotify or Apple Podcasts, and many more options that they have as well. It's everything that you need to make a podcast in one place, and Anchor is totally free, which is why I use Anchor. All these features are absolutely amazing. So download the Anchor app or go to anchor.fm to get started. Welcome to this episode of Teach Me on Through Jeremiah's Eyes. This is your host, Jeremiah Pouncey, and today I am joined by a very special guest. So you do clinical research on coagulation in animals, and as a veterinarian, you get a lot of experience with this on top of that. So could you teach me about coagulation and how it is involved in animal health?
Yeah, sure. It's one of the most complicated things I think I've ever done. And, nothing simple is fun. I mean, the wicked problems we have to deal with all the time, the more complicated they are, the more they're worth diving into and figuring out. So as a veterinarian, I guess I should introduce myself. I'm Karl Jandrey. My name is Karl Jandrey. I am an emergency critical care specialist at UC Davis. That's one of my hats. I also am the Associate Dean of Admissions and Student Programs. And as a faculty member here on campus, we also do teaching and research. So I teach in the clinic as well as in the lectures and labs and discussion-based sections for all of our students from first to fourth years. Because I came in here as a clinician, as a specialist in the animal care side of things, I developed this interest in learning more about the things I didn't have answers to in the clinic. So when I'm in the clinic and I have an animal and I'm doing the best I can, but the best I can has holes in the information that's known, I started asking questions, as all inquisitive people do. And I asked people, why don't we know this? And of course, it was about coagulation and a certain disease in cats that I'll tell you about in a second. So people started saying, oh, I don't know, what we could figure that out. I'm like, oh yeah, we can. How do we do that? And then we have a collaborative group of people get together around a topic and say, here's the things we need to do to figure it out. So we start figuring it out. But again, it's a complicated, wicked problem. We need to have multiple prongs of attack so that we can actually hone in on it. So let me dial it back to say, okay, coagulation is the process by which our liquid blood turns into a solid clot with a gentle stimulus. The funny thing I think is fascinating about blood and coagulation is at any given time, we're sitting here bleeding and clotting. Right now, I'm talking to you, I'm developing some clots, my body's breaking down those clots, and I'm protecting the blood to stay where it needs to stay in the vessels, but not let it leak out and go anywhere else. But at the same time, I can't stimulate a clot and have it go uncontrolled, because then it would block my blood flow. And then everything downstream of that loses the nutrition that the blood brings. And blood
sounds like it'll be affected by that.
Oh, it's bad when you can't get blood to where it needs to go. That's a whole nother topic of discussion of what happens when you don't have blood feeding your tissues. But the fascinating thing about it, it's so tightly regulated and it's so controlled because it's liquid. Let's just say it again. It's liquid, which turns into a solid. And to me, that's just crazy. That's eloquently built, but how does that actually work? So we have blood. It's made up of red blood cells. The red blood cells carry oxygen to our tissues. It's full of plasma. Plasma is the acellular part of the blood that is full of proteins and sugars and enzymes and things that we need to feed our tissues as well, and also to have components of the clot. We have other cells like white blood cells, which are infection fighters. They're tending to be the ones that monitor and protect us against invaders, whether they're bacterial, viral, or other. And platelets. Platelets are those sticky little cells that are probably the most interesting to me and the most complicated, because those cells completely unravel themselves and become the network to build the clot from these tiny little, they're the smallest cells that we have in our blood, but they become the biggest player when a clot is needed. They truly unravel. So this blood, so red blood cells, white blood cells, platelets, plasma inside a vessel are flowing along happily because the heart's pumping it around. It's a big circuit. Blood comes to the heart pumps out the blood goes to all the vessels, through all the vessels to the tissues use the nutrition that the blood brought. The blood leaves the tissues relatively depleted, not zero, but lost some oxygen, lost some sugars, picking up some products that are waste products, brings it back to the lung spits out all the extra carbon dioxide, and the heart gets the blood again, back out to the circulation. It's just a big circle. So this blood is moving through this entire network, and the network called the blood vessels is completely lined by the cells called the endothelium. The endothelial cells are a big player in keeping blood flowing smoothly, but those are the cells also that help in the state of injury to say, here's an injury, there must be a leak in my vessel, I need to act too, and I need to call the blood and the platelets to this area so that the blood doesn't leak out into the tissues outside of the vessel, but also keep it in check so that the vessel itself doesn't clot completely. So it's trying to flow. It's trying to maintain flow, but it's sealing the wound in the endothelial cell at the same time. So there's things from the endothelial cell that play a big part in this. There's the plasma of the blood is playing a big part in this, and the platelets are playing a huge part in this as well. So you're getting this coordinated effort from the blood, the cells, and the endothelium to create a clot. Again, it needs to seal the hole, but it can't clog the whole vessel because it will block flow to the rest of it. So I think it's utterly fascinating. And that's why I got into this coagulation world, because I'm like, how does this work? It can't be so simple that it's like, there's a hole in your vessel. It stops the bleeding by building a clot. And then what happens to that clot? The clot has to go away at some point in time, right? Yeah. So there's a part of the process called fibrinolysis. So that's the breakdown of the clot. And the funny thing is, the body regulates this so amazingly well, is that the minute you begin to produce a clot, your body begins to break it down. It doesn't wait for the clot to be completely formed. It says, because you had to create a clot for the wound in your vessel, I know I have to break down the clot that I'm making. Otherwise, I'm going to plug that vessel,
block everything,
and block downstream flow. It's like a dam on the river. Yeah, you can block the river, but people in the villages downstream still need that water to live. So it's kind of an analogy of the river. So the clot's the dam.
That was a really good analogy. Oh, a really good analogy.
There's so many different analogies I can come up with. Like my favorite analogy is the cat and the platelet. So everyone knows cats are very mild and calm, and they like to sit in a sunbeam and sleep in a little circle, and they're all super quiet, super cute. That's what a platelet's like flowing through your bloodstream. It's quiescent, it's very circular, it doesn't bother anybody, nobody bothers it. It's just hanging out. But, if a dog comes over to sniff that cat, and the cat doesn't like dogs, the cat freaks out, stands up, puffs up its tail, arches its back, hisses, growls, spits. Like, that cat doesn't want to be anywhere near that dog. That's what an activated platelet looks like. It came out of a quiescent state. When someone tipped it over by a stimulus, that platelet expands its surface area, it unravels its cell wall and creates a huge surface area for coagulation to begin to happen, because we get platelet interactions, we get platelet endothelial interactions, and then we find it be creating a meshwork like a net that is forming at the site of the injury. And in that net, the body starts to incorporate all these proteins to create a nice big clot. And the big protein condenses down to something called fibrin. So fibrin forms the meshwork in between all of these platelets that have created that net-like structure at the endothelial surface. And again, while it's forming the net, while it's building fibrin, the body's also creating things and sending out signals and chemicals that are going to be breaking down fibrin.
Yeah. And that's very interesting that it's building something, but at the same time having to kind of reverse the process at the same time.
Yeah. And platelets, inside platelets themselves, they have little chemicals and granules inside the cell that stimulate coagulation, and also the same cell has little chemicals inside that reduce the coagulation and break down fibrin. It's pretty cool. So I was drawn to this because I'm like, how does that work? How does that absolutely work? It's so complicated, and it blows my mind that it actually happens and that it was created that way. I'm still trying to figure it out, because as you dive deeper and deeper into the information, I mean, this is what people's PhDs are built off of.
And that's how it's like with a lot of science. I feel like the research, when I was able to get into research, that was my thing. I had a topic, but then when I started diving into it, then it was like a multitude of questions just started branching off in a whole bunch of different ways. And I'm like, this is insane. I could spend my entire life researching this one specific thing and still never arrive at an answer, because the deeper you go, as you were saying, the more questions you're gonna have to ask.
And I think that's true. And it's the nature of the people who go into professions like veterinary medicine and people who go into research for PhDs. You're so inquisitive, you find really cool stuff happening, you learn stuff, you learn more, and in the process, you learn more of what you don't know. It seems like we uncover more questions than we answer. And at the same time, that's kind of fun.
I was going to say that's fun.
Yeah, I find it fascinating. I think I'm so privileged that I get to do this kind of fun stuff. I get to do the kind of research that I really like to do in academics. I really still like to take care of animals and take care of people who own them. Like that's how I came into veterinary medicine. I came in as a clinician. I was just going to take care of people and their pets. And I never thought about teaching. I never thought about being an academic administrator. I never even thought about teaching in a veterinary school. But because of my opportunities and all the things that were presented in front of me, I just said, that sounds like a fun opportunity. And you go with it. So I became a clinician at UC Davis, but then I became more interested, did a master's that allowed me to learn how to do research better, had a mentor, developed collaborative teams, started working on cats with cardiac disease, and questioned them, why are they building clots when other cats tend not to build clots? So I can go into cats with hypertrophic cardiomyopathy if you want.
I was going to ask you, like, what was your, like, the clinical side of everything? How have you been able to see this in, like, real life with patients? What, like, real implication has this had? And I think you said hypo something, I forgot it says.
Yeah. So as an emergency clinician, a common problem I see in cats is related to something called hypertrophic cardiomyopathy. So hypertrophic cardiomyopathy, or HCM, is the most common heart disease in cats. Not all cats get it, but when cats get a heart disease, this is the number one type of heart disease in cats. When I'm an emergency clinician and I'm taking care of people and cats, and they bring them to me, the cats that have emergency presentations relating to hypertrophic cardiomyopathy are extremely life-threatening, and they are often fatal. So I'm an emergency clinician. Okay, think about it from my perspective. I'm a veterinarian. I'm just out of my residency. I want to save the world. I want to save every cat. I want to help every person. And when I get a problem that's presented to me again and again and again, and it tends to end up being fatal almost all the time, you become kind of sad, right? I'm like, I'm here to fix things. I know a lot. I've got tools. I have a great education. Why don't we know more about this? So let me just paint a picture. Someone comes home from work. They pat their cat on the head. They are cooking their dinner. And the cat screams out in agony, pain, and can't walk with its back legs. That cat owner scoops up the cat because this is a huge change in a normal cat, young, medium age, old. They bring it to me. I see the cat. So on physical exam, I hear its heart, I hear its lungs. Sometimes they're having respiratory difficulties. They're definitely in excruciating pain. And I find that they have no blood flow to their back legs. There's no blood flow through the femoral arteries on my physical exam. If I see this constellation of things, relatively normal, healthy cat, no previous medical issues, acute, we're talking per acute, instantaneous, life-threatening agonal pain and inability to walk with the back legs, comes to my office, I find no blood flow through the femoral arteries. I may see them in respiratory distress. This is a very common constellation of problems that make me think that this cat has built a clot. That clot has dislodged from an area and it's stuck in the femoral artery or even in the distal aorta before it branches into both femoral arteries. And that obstructive clot starves both back legs of all the nourishment it needs. That is why these cats are excruciatingly painful, because it hurts when your nerves, muscles, and all your tissues aren't getting any nutrition. So I'm seeing instantaneously super life-threatening problems in this cat, and the client had absolutely no idea that this was brewing, because hypertrophic cardiomyopathy is often a very insidious disease. It's been happening and we don't actually see very many clinical signs. In my world, the most common presenting clinical sign for cardiac disease is this thrombus. So let me dial back a second. So a clot is the formation of the blood, the platelets, and the fibrin to create a ball to block the blood flow so it doesn't leak out of the vessel. A thrombus is what we call a clot that breaks off from that blood vessel and flies with the blood as a big, huge boulder, basically. And it flies through the bloodstream, goes to, it's going with blood. So blood flows down to smaller and smaller and smaller and smaller vessels. And then the farther it goes to the tissues. So sooner or later, this big boulder, the thrombus, is going to get stuck. And most commonly with cats with HCM, the clot is built in their left atrium. That's one of the chambers of the heart, a big cavernous space. So that thing chunks off, goes into the aorta, heads down the aorta, and gets stuck when it no longer can, the volume of the circumference of the vessel no longer can accommodate that thing. So this clot gets stuck. That's called a thrombus. So when
that's not purposeful, correct?
One more time.
Is that purposeful?
No, it's not purposeful. It's just how it works.
Yeah.
And the thrombus thing, I guess, in humans, that you may equate it to humans, the most common corollary you would think of what a human would get that's like a thrombus. People with atrial fibrillation can also develop clots when they have this heart dysrhythmia called atrial fibrillation. And that also can lead to clots. And those clots often get thrown through the carotid artery up into your head. And what that's called is a stroke. Well, if you get blood flow, if you lack blood flow to a region in your brain, that's usually a stroke or ischemic stroke. So that's the closest relationship that I think we have. But the vessel or the size of the clot in people is relatively small compared to the cats. The cats build these big clots and they fly down the aorta and they just get stuck. And when they get stuck, they have this clinical scenario of acute pain, acute pulselessness to their femoral arteries because no blood's getting through.
Yeah.
They can be in heart failure. They can have respiratory distress. And at the base of all this, they have a heart disease called HCM. HCM is a thickening of the heart wall, hypertrophic, so hypertrophy, thickening, hypertrophic cardiomyopathy, thickening of the heart muscle. So as the heart muscle thickens over time, the blood flow changes. The blood doesn't move smoothly through the heart as well. There's less space for the heart, or for the blood in the chambers of the heart, and the clotting is more likely to occur when they have thickening of their heart muscle. When it's subtle and mild, no big deal. Like I said, it's insidious. It's under the radar. No one knows about it. But when it gets bad, end stage, the cat may never have had signs of heart disease.
And it just happens.
We see it in the emergency room when they throw this clot. So of course, I feel somewhat helpless, and I'm educating the client. I'm saying, this is likely due to heart disease. Here's how we're going to do things to test it out. They're like, my cat was healthy this morning when I went to work. I'm like, I understand. It looked healthy. It was healthy until the symptomatology of its disease showed up. Now that happened, in retrospect, I now think I know what disease your cat has, and here's the tests we need to take to prove it. Here's some x-rays, here's an ultrasound of the heart, and then I can measure its blood and see if the blood has certain things that refer to being clot prone or not clot prone. So it's a balance. It's like a teeter-totter. Your body is always in balance. You're always saying, I am clotting, I'm bleeding, I'm trying to keep it a straight teeter-totter. But if you get one fat kid on one side, that's down there, and the light kid on the other side is lifting it up, that's off balance.
Yeah.
And at one point in time, the heavy side is pro-clotting, but it also can happen the other way around, that the balance tips and you get more bleeding. And I deal with this in the clinic all the time. So there's different ways, patient side, that we look at blood to try to determine, is it pro-bleeding or is it pro-clotting? And different measures mean different things to us when we have a clinical problem right in front of us.
That's really cool and really interesting. I can see why it can go into a whole bunch of different questions and trying to figure out everything. What is the most interesting case do you think that you've had that you were like, oh, my knowledge on coagulation is helping me like be able to understand what's going on here?
Okay, so the more you learn about coagulation, we already talked about the more you want to learn, because there's so many questions that are opened up, whether it's clinical questions or research questions. So
all the time.
In the process of knowing about bleeding and clotting as a sort of a basic physiologic principle, there's a lot of things in that process can be thrown off. I mean, there's a lot of different things that cause you to clot, and there's a lot of different things that cause you to bleed. So some of them that I find the most fascinating all revolve around the platelets. I already told you I'm very fascinated by that cell, and that I'm very fascinated by the cell can be both pro-clotting. Platelets can be extra sticky and more prone to clot, but they can also be extra weak and more prone to bleed. Like if you have platelets that are differently abled, not able to activate, not able to turn into that big puffy arched cat with the poofy spiky hair. Like sometimes platelets can't actually activate to become the sticky meshwork to help build the clot at the area. Yeah. So one of the very rare diseases that I've met a patient, I've been doing veterinary medicine since 1992. This is my 30th year class reunion this fall. And I've seen one animal with this one disease once in my life. And I don't know if I'll ever see this dog again. But it's a disease where it's an inborn error of platelet dysfunction that does not allow the platelet to actually turn into a procoagulant cell. Therefore, coagulation doesn't occur normally. Sometimes it doesn't occur at all, because you have to have this balance. I said it was the endothelium, the plasma, and the platelets. You need many different things to go in. And if you don't have one or two of those three things, you're going to bleed. So because this platelet disease in this dog was it was inborn error. It's a genetic error so that the platelet does not actually develop a procoagulant surface. It's called Scott's syndrome, and it's in people, rare in people. It's rarer in dogs. And guess what? It's German Shepherds. It's known in a specific line of German Shepherds in mostly in and around the Northeast. Dr. Marjorie Brooks is a veterinary medicine specialist who's devoted her life to coagulation at Cornell University, and she's the world's expert on almost everything animal related coagulation. She's kind of one of the most amazing people, and I read her journals and her publications. She's just amazing. And she published the first work on Scott's syndrome. So when I had this dog come to me here in Davis, and I'm like, this is weird. And it all was pointing towards a dysfunction of platelets. I got on the email because we've collaborated for many years, and I always ask her questions because I think she's a good resource for me and my interest. So we talked about how to figure it out. So oddly enough, my dog here in California, German Shepherd dog, had Scott's syndrome and was the first one outside of the known litter and genetics out there on the northeast. So it's interesting that it's the same disease that we've proven, but it's from a different line of German Shepherds. We think, like, we're trying to trace down their pedigrees, but we didn't really find any overlaps. So that makes it kind of weird. So when these dogs bleed, there's no way to fix them because their platelets don't work. They're born with platelets that don't work. So to fix it, you have to give them platelet transfusions. You actually have to give them a blood transfusion that is rich in platelets, because you're basically giving them platelets that work because their platelets don't work. So that's probably one of my most fascinating ones, probably because it's so rare, and because it's rare and it didn't match the profile of the published dogs with Scott's syndrome. That made it even more weird. But the client is a great friend of mine now because we bonded over her dog. We've talked about it. We've published a paper on this, and I don't think I'll ever see another one in my life. But it was super interesting. But I needed to have all this other information about coagulation and hemostasis. Otherwise, I would not have been asking the questions and diving deeper, because this diagnosis is extremely complicated.
I was gonna say it sounded complicated. That's really cool though. But also the way that you explained everything made me understand what was going on and actually conceptualize it. So that was great as well.
I mean, I find it fascinating. And I mean, I think that's what happens when you're a problem solver. You're just like, this doesn't make sense. Someone somewhere at some time's got to figure this out. But I might not see it. I might not find that patient. I might not be able to figure it out, but hopefully someone that I train might be smarter than me. They all are smarter than me. Let me say that again. Someone who I train who's always smarter than me will be smarter in the future and develop a better program to figure things out. And we only keep learning in medicine. The expansion of information that we need to know is amazing. Like it's impossible to know every single thing about everything in veterinary medicine. I mean, if I focus just on dogs and cats in the emergency room and in the ICU, I still don't know a lot of stuff. But then now I'm trying to say, okay, if I want to be an expert and know everything I can in one area, let's talk about platelets in cats with heart disease. I still don't feel like I know a lot, because I still think there's so much to learn and so much to explore. What I think our approach to veterinary medicine now is, I think we all kind of know things, not the depth, but we know quite a bit breadth on the things that cause clots in cats with heart disease. Right now, we're focusing a lot on what's the best way to prevent this life-threatening clot building and thrombus formation. You know, I talked about the thrombus being the thing that's thrown through the blood. So they have to talk about building the clot. Let's slow down clot building. Let's try to prevent clot building. And we got to prevent it, but we can't over prevent it, because guess what happens if we over prevent clotting? You bleed.
Yeah.
I don't want my therapy putting my patients at risk for bleeding while I'm trying to prevent them from clotting. So again, it's about restoring the balance. Yeah. So we think we know what we need to do. We have philosophical approaches, and we know we have some medications that might help in different areas. But we have so many different approaches. We're still trying to figure that out. And there's a lot of different things we do with cats that have heart disease that currently do to prevent building clots and the thrombus from being formed and throwing around the vascular network inside a cat. And I can tell you we're doing the best we can, but still it doesn't prevent every single one. So even on preventives, we don't 100% prevent clots from happening and thrombus from cutting off blood flow to the back legs.
That's really cool though. And all that, I'm excited to see what you come up with next and what everybody like collaborates on to try and figure out all the different intricacies of it. Because even now, I'm really intrigued by it. So I don't know.
There's lots to learn and there's lots to do. It's just, I need a team. I need time. Of course, everything can be solved with time, people, and money. The grants that we can get, the collaborative teams we can build, and the time we can get devoted to it. We just have to find the secret sauce so that it all happens one day.
I love it. But thank you so much for joining me on this episode of Teach Me and sharing your deep breadth of knowledge on this subject and topic of coagulation and everything in between, all the intricacies of all your research about it. It was really interesting. But yeah, thank you so much, genuinely. I hope that the audience loved it as much as I did. I was really intrigued by it, genuinely.
My pleasure. I'm happy to talk about it anytime.